My name is Karissa. I'm going to be performing the NG tube feeding validation video. I'm going to start by performing hand hygiene. And I have pulled the curtain and provided privacy for my patient. Hi, how are you? My name is Karissa. I'm going to be your nurse today. Are you feeling any pain or anything? No? Could you just state your name and date of birth for me? Okay, so I have identified the patient using two identifiers, and they are feeling no pain. So I'm going to start by raising the bed to a comfortable working position for me. Okay. And do you have any problems laying flat at all? No? Okay, so I'm just going to lower the head of your bed. I'm going to be performing my abdominal assessment. So I'm going to inspect the abdomen looking for any distension or masses, and I do not see any. So I'm going to start to auscultate. I'm going to listen for 5 to 35 clicks per minute in each quadrant, and if I were to not hear any clicks, then I would listen to each quadrant for 5 minutes. And I was able to hear the bowel sounds. So now I'm going to lightly palpate. But first I'm going to put on gloves before I palpate. And while I palpate, I'm going to also look at my patient's face to make sure that there's no grimacing or anything, noting that they are feeling uncomfortable during any palpation. Okay. Just let me know anytime you feel any pain. Again, I'm just checking for any masses or distension. No pain. There's no rebound tenderness or pain. So I can remove my gloves. And I'm going to cover my patient back up. And I'm just going to go ahead and I'm going to sit you up and we're going to do the NG tube feeding. Making sure that I raise the head of the bed to a 45-degree angle. Okay. So I'm going to drape my patient. And I'm going to start by removing about 5 cc's of gastric content. And I'm going to place it in the bowl and putting a strip inside to check the pH level, making sure that it is less than 5. And then I'm going to remove the remainder of the gastric content until I receive none. And measuring it, making sure that I receive less than 250 milliliters. And if I receive more than 250 milliliters, then I would notify the healthcare provider and withhold the feeding. I have received less than 250 milliliters, so I'm going to pour back the gastric content. And if my patient was feeling any abdominal pain or cramping, then I would lower the tube, and if it was to make the feeding go down faster, then I would hold the tube up. I'm going to keep doing that until all of the gastric content is back. I would flush it with 30 milliliters of saline. And then now I can start the feeding. So I'm going to wipe the top of this and make sure to shake it up well. And I'm going to check the document for the correct amount of feeding. And I'm going to pour the content. Doing that until my patient receives the amount that was prescribed. And once that has gone down, I will flush again with 30 milliliters of saline. Okay. And then I will leave my patient in this position for at least 1 hour and then come back and assess my patient.